Hello, this is Dr. Sam Sunshine, and Happy New Year. We're in the first week of January 2021, and today I'm going to be talking about vaccine allocation for the COVID-19 vaccine. So we've gone away from doing Facebook Lives to doing more scheduled talks that will be given and distributed exclusively to the members of our direct primary care practice. So if you have access to this, you're probably one of our members. And our direct primary care practice is very affordable and gives you great access to myself and my staff. So first, I'm going to share my screen, and we're going to talk a little about vaccine allocation. And here we go. Maybe not. All right, so vaccine allocation, what to know, what do we know now is really the question. Healthcare workers have been deemed to be top priority, and these are doctors and healthcare staff that are actually taking care of COVID patients in the hospital. These are the highest priority groups. Beyond them, there's teachers, first responders, grocery and restaurant workers, and I'll talk a little bit more about the different phases of vaccine allocation. It's a question that we're getting asked over and over again, and so hopefully this video kind of helps everybody get a better understanding of vaccine allocation. It will probably be well into the year until the vaccine is available to the general public. And that's expected by June that those who want the vaccine will have an opportunity to receive the vaccine. Initial allocations have already started. They did arrive in Southern California on December 13th. So it's been a little more than 3 weeks. This is a major milestone in the nation's largest vaccine effort. This has never been pulled off before, so it's going to be very interesting to see how it works. So it's pretty exciting just to see the effort, this COVID-19 Warp Speed program. In California, again, priority will be given to healthcare workers on the pandemic's front line. And these priority phases are developed by the CDC, or the Centers for Disease Control. The CDC receives guidance also from the California Department of Public Health, so they're teaming up, and I think the CDC teams up with each state to determine proper allocation in that state. Long-term care facilities residents are also included in the initial phase of the vaccine program. So when the state gets the distribution of vaccines, it is then given to the counties, and Los Angeles County and Orange County will then distribute the initial vaccines to acute care hospitals. And if you're in South Orange County, that's gonna be like Hoag and Saddleback and Mission Hospital, and then also at UCI, or the big hospitals here in South Orange County. And doctors are already getting vaccinated. Myself, I'm an outpatient doctor. I'm not considered a frontline physician or healthcare worker. So I'm going to be in a later phase. But really the vaccine right now, we can't meet the demand of people who are in that phase 1A. And I'll talk a little bit more about that. Vaccine distribution to these long-term care facility residents, interestingly enough, will not be handled by the county, but will be conducted by a federal contract with some of the local pharmacies like CVS and Walgreens. So differences, one is state and county run. These long-term care facilities have federal contracts, primarily through Medicare. And so those will be handled differently. And so that'll be interesting to see. Again, these long-term care facilities, these people are not going to be going to the pharmacy, but somehow the pharmacy will be providing vaccinations to the long-term care facility residents. So following healthcare workers and these long-term care facility residents, the vaccine will be distributed to essential workers, grocery and restaurant workers. And I'll get into more detail about where you would fall depending on what kind of work you do. And that's going to be how we're going to be determined and the health you're in. So that was phase one. This is phase 1A. This is phase 1B. And these are frontline essential workers, which is another huge portion of our community. These are the firefighters and law enforcement, correction officers, food and agricultural workers. That's a lot of people. U.S. postal workers, manufacturing workers, grocery store workers, public transportation workers, and then the education sector, which includes teachers and their support staff. And then persons over the age of 75. So if you're over 75, you're going to be in this phase 1B. So once they give the 2 vaccine series to healthcare workers and long-term care facility residents, phase 2 groups will then be offered vaccine. This is vaccine allocation phase 1C, and this will be after phase 1B. And these are persons aged 65 to 74. That's a pretty significant portion of the baby boomers and a significant portion of California residents. And also persons aged 16 to 64 with medical conditions that increase the risk for having severe symptoms from COVID-19. And I won't get into too much detail about what those are, but it's people with chronic illness. And that even includes people with hypertension, congestive heart failure, COPD or chronic obstructive pulmonary disease, and then kidney issues, just to name a few, type 2 diabetes, type 1 diabetes, and then all other essential workers in transportation and logistics, water and wastewater services, sheltered housing, which includes construction, engineers, IT, and communications. And there's a longer list of people that are in this phase 1C. The demand for the COVID-19 vaccines is expected to exceed supply. We're seeing that already, but we are ramping up, or the companies that are making the vaccines are ramping up manufacturing. But these first few months, we're going to see a higher demand than supply. So what about distribution to the general public? That's kind of cut off there. That should say public. And that's people who aren't in phase 1A, phase 1B, or phase 1C. But they do believe this will take place months from now, probably in March or April. It'll be offered to the general public. The head of Warp Speed program said about 1/3 of Americans should receive the vaccine by March. And that includes probably the phase 1A, 1B, and 1C. And then the entire US population should be vaccinated, and that's misspelled, I apologize, vaccinated by June. Currently, there's between 20 and 40% of the population that does not want to receive the vaccine, and currently there is no mandatory vaccine rule that's been put in place in California, and I don't anticipate that. Whether there be some sort of a requirement or mandate that if you fly internationally that you've got to show proof of vaccination, that's to be determined. The initial doses will be limited as vaccine manufacturing increases production. And distribution locations, surprisingly, will include places like schools, libraries, and current testing sites. You see those big white tents that are set up. A lot of them are outside Rite Aid or CVS, and then other pharmacies. So that's going to be where a lot of the distribution to the general public is going to occur. And I'll talk a little bit about why it's not going to necessarily happen in hospitals, in doctors' offices, which would seem like the typical location for getting a vaccine. But I think because of the vast number of people who are going to be requiring vaccines, it's really going to be more of a team approach, and you're going to need larger settings to vaccinate the 300 million people in the United States. There is this Calvex system that's going to be rolled out sometime in mid-January, and this is going to replace the COVID Ready system. This program does allow physicians like myself to enroll in this COVID-19 vaccine program. It allows physicians like myself to request vaccines. to manage vaccine reporting tasks and to update account information, those people who are getting a vaccine, and it's going to probably go into a big database, so we know who's received the vaccine. I think that's going to be important information, just to gather data so we know how many people are receiving the vaccine, who are receiving the vaccine, who are not yet. And then again, the pandemic continues. We're still on an upswing. Nearly 4,000 people are dying every year in the United States, every day in the United States from COVID-related illness. And it's been very unfortunate, really, since travel started for the Thanksgiving holiday. We've seen this upswing. Hopefully things will start to level off now that people aren't traveling for the holidays. And again, I still think it's important to social distance, wear masks. And then if you are feeling sick, to self-quarantine. We are going to be getting in our clinic some nasal swab testing that we'll hopefully have by early next week. And so people will be able to come and get tested if they're having symptoms. Usually people will just be staying in their cars. We'll have them hand them a nasal swab, and they'll self-administer the swab, and then we can get rapid results within about 10 or 15 minutes. We also have the rapid antibody testing. So if you think maybe you've been exposed, but you're not sure, we can test for antibodies. That's also relatively quick. We get results in about 10 minutes. It is a finger stick. It's a sharp poke. We get a sample of blood from the tip of your finger. And again, we get rapid results that way. And you can schedule for either of those tests in our office. So again, this Calvex program that begins in mid-January will allow offices like me to actually administer the vaccine. And what I'm going to test is what percentage of the direct primary care members that I have would be interested in coming here for the vaccine versus going to a pharmacy or one of these other locations. I think I'll probably allow those other facilities to help with the vaccination process. If it seems that this office is needed as well, then I will certainly do my part to help administer the vaccination. Because we're a small solo practice, we have a small office. We just don't have the manpower at this point to vaccinate a lot like they'll have at some of these other facilities. They're going to be run by the county. So one of the questions that comes up is how many vaccines are needed? And I think most of you know all the vaccines that are being developed or that have been developed are a 2-shot series, except for one. The 2 that are currently available, one is Pfizer, and the second vaccine is given 3 weeks after the initial vaccine. And then Moderna is the other company that has a vaccine that's available, and that second dose is 4 weeks after the initial dose. So relatively pretty similar. Again, the Pfizer one is the one that's got to be stored at extremely low temperatures compared to the Moderna. We don't have any long-term studies on these. These are both new vaccines, and we'll see. We'll see how long immunity lasts for. We do know when you get a second vaccine, you get that booster. It really magnifies the intensity of the immune response. And so that if you do come into contact with COVID, you already have antibodies that are armed and ready to isolate and kind of subdue the COVID viral infection. It usually takes a few weeks after the second vaccine to receive full protection. So it's good to know that. And that's a question that's oftentimes asked. And then how long will these vaccines provide immunity? We really don't know. We're hoping it's going to be more like the measles, mumps, rubella, where it will last years, the immunity, versus the influenza vaccine, which is an annual vaccine. I certainly hope we don't have to start to institute annual COVID vaccines, but it's possible. And we'll know more probably by this time next year. We're probably into the fall of 2021. We'll probably have more data as we start to test people who have been vaccinated to look at their immunogenicity, or their immune response and their antibody response. So what are some of the side effects? And this is another common question that we get. The serious side effects like anaphylaxis where your body swells, you become short of breath, you have a severe reaction, is rare, fortunately. I think if we had a high incidence of severe side effects, this vaccine would never have made it to market. The Department of Health and Human Services report that about 10 to 15% of vaccine volunteers, and these are the people who got it in the phase 3 clinical trials, experienced side effects of the vaccine. And these were some of the common side effects that you would get if you got the vaccine or it got the infection, the viral infection, and that's fever, body aches, headaches, and fatigue. Most side effects, this was according to questionnaires filled out by the volunteers, lasted about a day. So they were there, but they were gone quickly. One important note, again, if you're listening, paying attention, I think we're about 10 minutes or 15 minutes into this discussion. Most of you maybe have lost interest, but one of the key things is if you do have a fever, body aches, you want to refrain from taking Advil or Aleve. Because what happens if you take an anti-inflammatory, in particular, Advil, Aleve, naproxen, Motrin, ibuprofen, it kind of subdues your body's immune response. So that immunogenicity gets dampened. And that's what you want to avoid. So we know from studies of influenza and some of the other vaccines that have been given in history, if you're taking anti-inflammatories, your immune response is less than if you don't. So it's really important that if you do get a fever, body aches, you do not take an anti-inflammatory. Can make the vaccine ineffective because it suppresses lymphocyte response. So really important. And again, if you can remind other people of this, I have heard very few people talk about avoiding anti-inflammatories after the vaccine in the press. So again, pass on that bit of information. The FDA has said that there is insufficient data to make conclusions about the safety of the vaccine in children under 16, pregnant women, and immunocompromised patients. So at this time, you really have to be over 18 to receive the vaccine. There are ongoing studies for younger people between 12 and 17 that are ongoing now to look at safety and efficacy. So another big question that comes up is, what if I already had COVID-19? I was already stricken with the vaccine. Don't I have antibodies? The answer is yes, you do. And then the question, and then the other answer, do you need the vaccine? And that's a good question. And I don't think we have an honest answer. The FDA still feels that it's a good idea that if you had the vaccine to get vaccinated, and that would still be a 2 vaccine series if you're doing the Pfizer or the Moderna. Those are the 2 that are out currently. And the FDA believes that a patient who already had the virus may still be at risk of reinfection. But we do know that the risk of reinfection currently is very rare or uncommon. So it's kind of interesting. Again, I think we'll know more over time that if you had the infection, do you need the vaccine, will be more clear, and we'll be able to give a more educated answer to that question. But if you've had COVID and you're interested in the vaccine, the FDA recommends you do get the vaccine. Okay, so another big question is, we're still trying to find out, when I say we, the researchers who are studying the vaccine, how long the antibody response lasts, whether you've got the infection or if you get the vaccine. We don't know how long that antibody response is going to last, and it's going to probably vary from person to person. A factor may be age or underlying health. So we'll know more in the future. But if you do get vaccinated, it's going to protect you in the short term. And the hope is we get herd immunity, if we get 2/3 of the population vaccinated, in which case we're not going to see a spread of the vaccine. And that's kind of the definition of herd immunity. And that's what we really want. If we can stop the spread, this virus will go away, and we'll be able to resume some sort of normalcy. So again, you must be 18 or older to receive the vaccine. And we'll know more about children between 12 and 17. but there are no studies currently evaluating the vaccine in pregnant women. And there are women who are getting COVID, getting the actual virus during pregnancy. And at this time, it seems that they do well. And as far as we can tell, there is no effect on the developing fetus or the child, the newborn. And hopefully that continues, because that would be horrific. So that's the end of my talk. And unfortunately, we don't really have a Q&A here today like we would with the Facebook Live. But if you have any questions, you want to continue the conversation about vaccinations, if you have a particular question that pertains to you as an individual, just send us a text through the Spruce app, and we'd be happy to answer it. If you want to share this talk with friends and family members, please do so. Again, it's all about just educating everybody about the vaccine. And again, every week I'll be coming up with a new topic. We're in January. This is supposed to be a talk on heart health. But I think that the pandemic has really kind of captured our attention. And it's been a topic that I've been talking about for probably the last 4 or 5 weeks on my Facebook Lives. And I think it's more pertinent. The other thing about the new year is we're starting to hopefully develop good health habits. And that's another big part of my practice, is to instill good health practices in the patients that come into the practice. I started a detox today. I did have a talk on detoxing and all the different toxins, probably about, 5 or 6 weeks ago. The one company that I started to use is Designs for Health. Metagenics also makes a good detox. So there's a lot of companies out there that do really good detox. I just happen to pick the Designs for Health because it's easy. It's 2 weeks. Some of these are as short as 10 days. Some are 28 days. And it really depends on preference. But I think it's important. One of the keys with these detox programs is you have to be somewhat restrictive with your diet. You're eliminating alcohol. You're eliminating sweets, processed food, and canned food. Trying to eat more whole foods, lean meats, and staying away from processed, highly refined foods. Again, this is a look at the box. This is the Designs for Health Veggie Cleanse Plus. It just happens to be the one I'm on. I'm not necessarily endorsing this one. I think they're all very good. But it is an opportunity. If you guys are interested, let me know. I can have an email sent to you through FullScript where you can purchase one of these. We can do it together. Again, I started mine today. I like the flavor of their shakes. That's another rate limiting factor with a lot of these detox programs. This is a shake twice a day with supplements, a packet of 3 or 4 small capsules twice a day. And you do it for 2 weeks. It's pretty basic. And you can continue your regular routine. You want to stay hydrated. You can continue to exercise. You want to make sure you get good rest. But it's really about resetting your cell metabolism and trying to improve your overall health. And pay attention to how you feel before you start. Some people will come in and get body composition testing done before they start it. Other people will fill out what's called the medical assessment form, or MAF, and then repeat it in 2 weeks just to see what symptoms have changed. Were you having issues with digesting processed carbohydrates? Were you getting bloating after meals? How's your energy level? Do you get angry if you miss a meal? That goes away after doing a short detox. So those are some things to think about. Again, doing a body composition before and after, or completing these 2-page questionnaires called the metabolic assessment form we can provide for you to look at your symptoms before and after, just to see if it made a dent or a significant impact on some of your symptoms. Because again, our health is so important. It's our number one asset. Most people take it for granted until it is not working. And what we want to do is take care of ourselves and develop healthy habits and disciplines so that we can age gracefully and not spend our 401k savings on health issues. Again, thank you for listening. This is Dr. Sam Sunshine, OC Sports and Wellness. Until next time.